Hi, I'm Dr. Tripti Raheja. I'm consultant gynecologist and director of Raheja Clinic. My field of special interest is laparoscopic surgeries. Today we'll be discussing about cervical cancer. Cervical cancer is most commonly diagnosed cancer among women in India, and it is responsible for death of thousands of Indian women every year. Cervical cancer is cancer of cervix or lower part of the body of uterus, or you can say the mouth of uterus. There are several risk factors that increase the chance of development of cervical cancer. Most important of them is human papilloma virus infection or HPV infection. HPV infection is usually transmitted through sexual intercourse or skin to skin contact, and it causes changes in cervical cell which can be picked by pap smear testing. Another important risk factor is smoking, as smoking exposes the body to many harmful chemicals, and these chemicals damage the DNA of cervical cells. There are other risk factors also, like family history of cervical cancer, being overweight, or taking diet low in green vegetables and fruits, having more than 3 pregnancies. So these risk factors also increase chance of development of cervical cancer. Women with early stage cervical cancer usually have no symptoms, so that is why it is important to diagnose by doing regular pap smear despite having no symptoms. But in later stages, patients have abnormal uterine bleeding. They come to us usually with the complaints of irregular bleeding, such as bleeding after intercourse, or bleeding in between periods, or bleeding after menopause. Sometimes these patients come with bleeding of excessive discharge through vagina, which is usually foul smelling and blood stained. We can easily prevent development of cervical cancer. There are two ways of prevention. One is finding the precancerous lesion before they turn into a frank cancer. So for this we have pap test and HPV test. By doing these tests regularly, we can detect cervical precancer lesions, and we can treat them at an early stage before they can convert into cancerous lesion. Second way is to prevent the development of HPV infection. So to prevent the development of HPV infection, we have vaccines available with us. So these vaccines are given usually in 3 doses over a period of 6 months, and it is important to realize that these vaccines, they prevent infection from happening, but they won't treat the infection which is already there. So it is important to administer the vaccine before the onset of sexual activity. Usually they are advised between the ages 9 years to 26 years. These vaccines do not have any major side effects, though minor side effects like slight redness or swelling or soreness of the injection site sometimes can happen for 2 or 3 days. If you want any further information or further consultation regarding cervical cancer, you can contact me through Lybrate, you can call me, text me, or you can book an appointment through Lybrate.